You've heard the promise. One procedure, a perfect smile, problem solved. But what if I told you teeth implants come with truths most people hear way too late? Today, we're opening that door. No scare tactics, no sales talk. Just the stuff that makes you pause before you decide. Dr. Esma is with me, and trust me, this conversation might change how you think about implants forever.
Rasim, people are shocked when I say this. Dental implants can be life-changing, but only if you understand the full picture. Healing time, hidden risks, long-term maintenance. These are not small details, and skipping them can turn excitement into regret.
So if you're watching this thinking, should I do it or not, stay with us. Because in a minute, Dr. Esma is revealing the one question every patient should ask first. Almost no one does. Let me paint a picture, Dr. Esma. Someone finally fixes that missing tooth they've been hiding for years. They smile again, eat confidently, take photos. Then months later, discomfort shows up, confusion, panic. They think something went wrong, but really, no one explained what normal actually looks like.
Exactly, Rasim. Many patients expect implants to feel like natural teeth instantly. But your body needs time to accept them. Bone healing, gum adaptation, lifestyle habits. If those aren't respected, small issues can quietly grow.
And that's the scary part. Not the procedure, but the silence after it. You leave the clinic thinking you're done, when really, you've just started a new chapter. This is why it matters so much. Teeth implants are not just a dental choice, they're a lifestyle decision. What you eat, how you clean, even how often you check in with your dentist. Miss one piece, and that confident smile can slowly turn into stress.
I've seen it many times, Rasim. Two patients, same procedure, very different outcomes. One follows guidance, shows up for follow-ups, asks questions. The other assumes the implant takes care of itself. Guess who stays comfortable years later?
And that difference rarely gets talked about. We focus on the before and after photos, not the habits in between. In the next part, Dr. Esma breaks down what truly makes implants last. Dr. Esma, give us some context here. People hear implants have a high success rate and think that's the whole story. But success on paper and success in real life can be very different, right?
Exactly, Rasim. Clinically, implants succeed in most cases. But here's the part many don't realize. A large number of complications come from aftercare issues, not surgery itself. I once treated a patient who did everything right for the procedure, then ignored follow-ups. Within a year, problems appeared.
So the real risk isn't the implant, it's the assumptions people make after they get it. And that's a mindset shift most don't expect. Alright, Dr. Esma, let's get a bit nerdy, in a good way. When an implant really works, what's actually happening inside the mouth that people never see?
Great question, Rasim. The key process is bone integration. Your jawbone grows around the implant and locks it in place. That takes time, blood flow, and stability. If the body is stressed, healing is slow. If hygiene is poor, inflammation interferes. Science doesn't rush, even if people want instant results.
So the implant isn't just placed, it's earned. Your body has to agree with it. That alone changes how you look at the whole decision. Alright, Dr. Esma, people watching right now are thinking, okay, tell me what to actually do. Not theory. Real steps. Where should someone start if they want implants done the right way?
First, Rasim, a proper evaluation. That means scans, medical history, and honest expectations. Second, planning. Implant position, healing time, and lifestyle adjustments must be clear before anything begins. Third, commitment after placement. Gentle cleaning, follow-ups, and patience. Skipping any of these steps is where trouble starts.
So it's not one big decision, it's a series of small, smart ones. And when people follow that sequence, implants stop being scary and start making sense. Before we wrap this up, Dr. Esma, let's talk warnings. The kind people wish someone had said out loud before they jumped in.
Absolutely, Rasim. Do not rush decisions. Do not ignore pain, swelling, or bleeding just because someone said it's normal. And never assume implants are maintenance-free. On the flip side, do ask questions, do attend follow-ups, and do protect your gums like they matter, because they do.
So the real danger isn't implants themselves. It's shortcuts, silence, and assumptions. Avoid those, and you're already ahead of most people.